5 minutes to save a life. Could this be cancer? Raised platelets.
Hi, I'm Richard Roop. I'm the Hampshire and Isle of Wight Primary Care Cancer Lead, and I'm joined by Virginia.
Hi, I'm Virginia Quiney. I am a Wessex Cancer Alliance GP, covering South East Hampshire and Portsmouth.
So, Virginia, how is it that platelets and cancer have arrived on the same page?
Well, there was a BJGP study in 2017 which looked at 50,000 patients, which were over the age of 40, and they found that almost 8% of them that had thrombocytosis or raised platelets had a 1-year cancer incidence. This was found to be greater in men at 11.6%, but women still had a significant finding of 6.7%. And it's important to note that both of these figures are greater than our 3% threshold, which NICE has set for primary care staff to refer for further investigations for cancer. It was also noticed that if you did a second blood test, which the platelet count was raised or as it was or higher, then that 1-year incidence increased to 18% in men and 10% in women.
So, Virginia, does this apply to all cancers, or is it just some cancers in particular?
Well, they found a link particularly with lung and colorectal cancer, and there were some others that were linked as well. So NICE and SIGN have associated raised platelets with lung cancer, as I mentioned, endometrial cancer, esophageal cancer, gastric cancer, and colorectal cancer, and therefore come up with the nice acronym to help us remember this with LEGO-C. There's also been found to be an association with ovarian cancer, so perhaps we should now be thinking of it as LEGU-C.
Very good. So, talking about raised platelets, how raised do they have to be before we should be concerned?
Well, they looked at the upper limit of normal as being greater than 400. There are some labs that report this as 450, but certainly in relation to raised platelets and with the studies that were done, they used the cutoff point as 400. It's important to note, though, that when we're talking about raised platelets, we're talking about new and unexplained raised platelets. So it might be that you've got a patient that has raised platelets for other reasons, such as inflammation or another underlying condition. So we're not just talking about raised platelets generally, it is those that are new and unexplained.
It's really interesting. And what about sort of high normal range levels? Is that something that should be of concern?
Well, a later study in 2020, also in the BJGP, had a look into this, and they did find an association with high normal platelet counts, particularly in men over the age of 60, that this also could indicate underlying malignancy. So a level of 325 in this group of patients put them above that 3% referral threshold. So what might be useful is to be aware if patients start to drift away from their baseline, that might prompt you to think about further investigation. I think there's some stuff on the horizon here, so it may well be a little bit of watch this space.
That's really interesting. So, as a clinician who's ordered blood tests and they're now coming back from the labs, and it shows that the platelet count is high, what should I be doing?
Well, you want to think about why is it raised? So start off making sure that it is new and unexplained. Once you've got to that point, you would start with a systemic inquiry to see if there's any obvious symptoms which might suggest a cancer site and direct further investigations. If not, and you've got the opportunity to, then you might want to start looking at a chest X-ray and a FIT test as your next line of inquiry. And if you're working in secondary care and you don't really have the option of following the patient up, it'd be worth mentioning this information about the raised platelets and suggesting to primary care that they look into this at their end.
And what sort of things would if we are returning the patient to primary care and highlighting the raised platelet counts, what sort of things will they be doing?
Well, they would want to do some further, again, it depends what's been done so far. So if you've already done a systemic inquiry and not come up with much, if no investigations have been done, as I said, chest x-ray and FIT. And then if you can't find anything obvious, but you've got these unexplained raised platelets, then they could be referred to the RIS, the Rapid Investigation Service.
So, Virginia, what would you say are the sort of the two main take-home messages for me to go away with today?
Well, in summary, I think we need to be aware, firstly, of the link with raised platelets and cancer. And really, we're looking at new and unexplained raised platelets. So thinking about cancer and then thinking about those specific cancer types when you want to maybe dig a little bit deeper as to what might be going on.
Thank you so much. That's very clear.